Colorectal cancer is one of the most common diagnosed cancer. It represents an abnormal overgrowth of the intestinal mucosa. You can compare the normal mucosa here on both sides and the neoplastic one in the middle. Risk factors include age, male sex, smoking, family history, diet poor in fiber, and inflammatory conditions. Clinical presentation is variable: weight loss, iron deficiency, abdominal pain, blood mixed with stool, among others. Early stages are often detectable with screening, fecal, occult blood test and colonoscopy, and removal of precancerous polyps. In this case, the neoplasm is infiltrative and exceeds the muscularis propria layer. You can see a typical glance with cribiform pattern and necrosis. Prognosis depends largely on depth of invasion and lymph node status, vascular invasion among other items. Here we have a lymph node positive involved by the neoplasm. Surgical resection represents the treatment of choice, as in this case, and the pathologist is the doctor in charge of the correct diagnosis that guides the patient's management.